Welcome, everyone. I'm excited to welcome you to this episode of the Sunflower Podcast, a podcast exploring all aspects of children's palliative care around the world. Sunflower Podcast is going to bring curiosity, humor, and reflection to the world of palliative care. We're going to explore the joys and challenges of working in this incredible field, including topics related to education, advocacy, self-care, service provision, and leadership from around the world. Whether you're a nurse, counselor, pharmacist, doctor, or any other type of healthcare worker, or just someone who's interested in learning more about children's palliative care, then this is the podcast for you. I am one of your hosts, Rachel Neufeld, nurse practitioner at Canuck Place Children's Hospice in Vancouver, Canada. Today, I'm joined by Dr. Nusrat Jahan. She is a pediatrician, educator, and department head at Rangpur Medical College in Bangladesh. With over 19 years of clinical experience and an MD in pediatrics from the University of Dhaka, she currently leads the Pediatric Hematology and Oncology Department. Dr. Nusrat is deeply involved in undergraduate and postgraduate mentoring, guiding students through thesis work and clinical education. Her work blends compassionate care with academic leadership, advancing pediatric practice and ethical learning across Bangladesh. If you could just introduce yourself.
Hello, good afternoon to you. I'm Dr. Nusrat Jahan. I'm working as an associate professor in Rangpur Medical College in Bangladesh in the Department of Pediatric Hematology and Oncology. And currently I'm doing the fellowship in Pediatric Palliative Care from Two World Cancer Collaboration.
Thank you so much for sitting down with me. As one of our new 2025 fellows, I wanted to talk to you a little bit about what drew you to the fellowship and how this experience has been so far, and then maybe where you hope to take it in the future. And I'm very glad to be talking to you in person here in Dhaka. So I'm curious if you could tell us a little bit about your story and how you came to apply for and join this fellowship.
Thank you, Rachel. It is also very good to meet you in person. I was looking forward when I heard that you are coming to Dhaka. The thing is, why I came to this fellowship, or I could say that this fellowship chose me, maybe something like that. As I was a general pediatrician and working in general pediatrics for last almost we could say that it is for 17 years, and then. In Rangpur Medical College, I took the charge of Pediatric Hematology and Oncology department, but with no background from Pediatric Hematology and Oncology, to be honest. And then I started treating thalassemia, immune thrombocytopenic purpura. Those are the cases, hematological cases, and some few acute lymphoblastic leukemia, whom are in on maintenance therapy.
Right.
As I don't have any manpower. And one day I thought that I do not belong into pediatric hematology oncology, but I want to do something for this group of children. I want to make their lives a little bit easier, reduce their suffering. Then I started a poor fund. I don't know if you are familiar with that, because our patients are from below, some are very from below lower social class, so they have economic constraints. So
yes.
I collected. In our religion, there is giving away money that is called zakat, and I collected that money from my rich, wealthy friends and my sisters, and I started buying chemotherapy drugs.
Wow. Okay.
And I started that, and then I feel a little bit of peace, and then two. Doctor came with the hematology oncology background, and we started full-fledgedly, and some of my guilt has passed away. And one day I think that how could I do better? I'm doing all these things, making poor funds, connecting social welfare, talking about the investigations, how quickly that could be done, communicating with the physicians in Dhaka, and then the echo happens to me. And I realized that these are the professionals. I was doing this in a smaller scale, and there is a bigger scale, and it is out there, and I want to learn them from the professionals. And then I could do the echo, and then came Dr. Spandana. She motivated me, and I came here and started the fellowship. That's it.
So the Echo being the virtual teaching platform that Two Worlds was presenting, is that the Echo that you were talking about?
Yes.
And how did you get involved with, or how were you becoming aware of the Echo sessions?
Okay. The echo session was, I think Dr. Shaidur or some from the Two World has communicated with Dr. Medical College, and they have
Okay.
asked Rangpur Medical College for Periphery Medical College.
Yes.
That's one is Rangpur Medical College.
Yes.
It is a remote one. It is a very underprivileged one.
Right.
And my head of the department says, as you are running the hematology oncology unit, so you please do this. And I started the classes, and I think it's a
Okay.
whole new world, and this is I was looking for.
Great. So you were able to attend some virtual education.
Yes.
And then meet some of the Two Worlds folks.
Yes.
And then Dr. Spandana, who came to visit last year,
Yes.
helped encourage you to apply for the
Yes.
fellowship. And
Yes.
here we are.
Yes. Thank you.
So it sounds like you already had this underlying desire to reduce suffering in these children that you were looking after. What was it about this fellowship that drew you to it, and the reason why you wanted to actually spend a year doing this intensive training?
At my age, it's a little bit hard to study again, because I was, as I told, that I was on the other side of the table. Yes. For the last 14 years. Now the scary part is here. So I think that there are these there are some knowledges that I lack regarding pain, regarding some skills I don't know. The most important thing is the communication that I've learned. There are so many things I lack in communication. That has improved after all. After eco session, I have changed. I think I have changed almost 30-40% in communication. And I think at the end of this fellowship, there will be a new me with a new communication skill.
I think communication in pediatric palliative care in particular is one of the most vital skills that we can learn.
Surely.
And all of us can keep learning.
Yes.
It's never something that you're exactly proficient at, I think. We all can continue to learn how to be better communicators. Yes. So I love that that's been something that's really clicked for you. Can you tell me a little bit about what pediatric palliative care means to you?
In one word, it means love.
And
it means that compassionate care, empathy, it sounds like bookish, but these are the words I should use. Compassionate care to those unfortunate children and their parents living in a very resource poor setting, where a vincristine is a luxury for them. So, yes. So how to alleviate their sufferings? This is the main, I think that main thing is that to reduce the suffering of those people. It is the main thing in the pediatric palliative care. Right. So just a compassionate hand on their shoulder, it's enough sometimes. Yeah, so you're saying there's population here that you are looking after that didn't even have the means to get the chemotherapy that they needed to treat their diseases. And there's a lot of suffering that you've witnessed. Yes. And so doing this work helps you to focus on reducing that suffering. Yes. And improving how well they can live. Yes. I understand that you had a word in Bangla. Yes. That really described what this work was to you. Can you tell us in Bangla, what is this word? Yes, it calls proshanti. And what does that mean? It tranquility. Tranquility. Tranquility, or the inner peace. And so you're hopeful for inner peace in the children that you look after? I'll get my inner peace. Your own inner peace. And somehow, by some means, they will get a little bit of peace, a little bit of love. And it sounds like in being able to care for these children in a different way, that not only will it bring you a bit more tranquility and peace, but by reducing their suffering, we're improving peace in their lives. Yes, and hopefully also their family. Definitely. Because we know, caring for a child means that we're also caring for their whole family. Yes. So it sounds like a bit of a win-win situation where both sides of this equation might improve their overall peace and tranquility in life. Yes, sure. That's it. You have explained it better than me.
No, I just like to summarize what I'm hearing. So tell me a little bit about how this fellowship has been for you, and maybe what are some of the key points of learning so far? I know you talked about communication, but what has sort of been so far in the first few months the most outstanding learnings, maybe? And are there particular challenges that you're facing?
Outstanding learning points are the lectures. I think they are very professional. They are skilled and resourceful person in this field, and when they talk, it gets better every time. And also, I think the work they gave us to do, it gives us go through the books and prepare the things. As in our country, we were not accustomed to this sort of studying previously, so it is a different kind. And also they are very much supporting. The teaching faculty is very much supporting. I have never experienced such thing in my whole study period. They are very supporting. If I lack anything, they just support. They said how I can do better. It's no worries, we can do it. You can do it like this, that. And the challenges are, I have told you already, the challenges are studying at this age. Maybe I'm not the age about all these presentations that I have to make, because I am a little bit tech challenged, I should say. So now I'm okay with it, and not too much challenge. Maybe now I'm in adult rotation. I think I can do it. Yes.
Yeah, it sounds like it's a lot of work, but
Yes.
that it's feeling supported
Yes.
so that you can keep doing all of this work.
All of this work. Yeah.
Can you tell me a little bit about what you hope to gain from this fellowship and where you hope to see this go once you've completed the fellowship?
I want to see myself as a pediatric palliative care specialist, because it's the recognition is very much important. Because as I have started in Rangpur, I am the only one, and in Bangladesh I am the third person. So we are at the budding stage. So I have to convince my colleagues. So I need that professional degree, whatever you say, with behind my name, alongside my name, and so that they will be convinced that yes, it is coming from a professional. This word is coming from a professional. Thereby, I want to start in Rangpur Medical College, like the from a minimum thing, that is the pain reduction in my patients, in all the patients in pediatrics, and then increasing the communication skill in all level of doctors. I think I can start with that. And then there are bigger plans. I'd like to recruit volunteers. I'd like to train my nurses. So many things. I'd like to start a little home care. These are a lot of things I'm dreaming. I hope that one day this is the first step.
Yes.
It's a long way to go, but I think I'll complete the journey, or maybe I'll pass the baton to someone else.
Yeah, you're dreaming big.
Yes.
And that's exciting to hear. And also that you have a bit of a step-by-step approach to building a program. Because as you say, in Bangladesh, there's now 3 of you.
Yes.
As pediatric palliative care specialists.
Yes.
It's still very, very young in this country to be doing this work.
Yes.
So to recognize that we have to start with first steps. So I appreciate that your first goal is how do we improve pain in the children at my facility?
Yes.
On my wards,
Yes.
the children that we look after at this hospital can have better pain control.
Yes.
What an excellent first step goal, because it's completely attainable.
Yes.
Right?
Yes.
And then
much.
how do you gain momentum to move your program forward and to build into something like a community care program?
Yes.
What do you see that looking like in your community? Because it is, a bit more remote and so, less resourced. What would a community care program maybe look like?
Community care program may be difficult, but I think there is a lack of awareness about this type of program, about this palliation. But religiously, there is some reward. If you do without getting anything in return, it is beneficial for you. So there is a door through which I can enter into people's mind that let's come to palliative care and do this, and there will be bigger thing for you in afterlife. As Muslim, we believe that. So it is a way to get to into their heart. And also, I think we have to create awareness involving social important peoples and philanthropists. If they come forward and do this, then I think I'll overcome it. And very resource poor, but system still population is very large over there. So it is overcrowded a little, and resource is also poor. And I think in a few years we'll get to some point gaining this palliative care.
Yeah, those are definitely high aspirations and something that I think has started to build here in Dhaka. And so I think the hope of talking about now this workshop that we're both at right now, the reason why I'm here with this hope that people like yourselves that work in other settings outside of, Dhaka Medical College or BMU gain knowledge and leadership skills and the ability to take some of this with you to other places and then teach those around you. So, your goal to teach the nurses that you work with and to teach some volunteers to reach out into the community. That, I think, is also part of our goal in doing workshops like we're doing. So this 4-day workshop right now, we are inviting people from all areas of Bangladesh so that they can learn the basics of pediatric palliative care and then take that with them back to their locations outside of Dhaka and hopefully spread awareness, like you're saying, so that more people in this country can start to be aware of this work.
Very much. This program is, I think it will be very much effective. As I personally asked every faculty in my department to join this program. I asked every assistant register and only 4 of them made it because everybody has some personal different work days and different issues. So, but they have kept their promises and came, and I feel very good about that. I think these 4 people, when go back to their our hospital, working in different units, so they will teach their residents. They will teach their nurses, and one of them is today saying that from now on, no lumbar puncture will be done without pain management. So that was the thing I was looking for.
Yeah.
And you also.
Well, and that's what, we just talked about today, right? Is how do we improve pain management in children? And then specifically talking about procedural pain management. So how are we treating a child before a procedure to ensure that it's done more comfortably, so that these children aren't in pain for lumbar punctures and bone marrows and IV starts and things like that.
We can do this. Very resource person, it could be done.
It can be done. So the fact that we now have champions, the 4 of you that have come, you'll be championing this idea to take back to you, to your facility, to say, we can improve pain today in these children. That's pretty remarkable, I think. What are you hopeful for the rest of this workshop before you go home? Is there anything in particular that you are hoping for?
Yes, I think in this workshop we should learn how to prescribe morphine accurately and also give some end-of-life care in home care.
Right.
But over the telephone, how can we support the children, and also some spiritual support.
Yeah.
So we have to learn this. This spiritual thing is very new for us.
Right.
We thought, before palliative care, I thought spiritual is religious.
Yes.
But now I know that it's not the same thing. It's a part of the religion is part of the spiritual, but not the whole thing. So we have to learn this. Yeah. We have to bring this confusion, break this confusion.
Yeah. Yeah, and my hope too is that there's some awareness of how we can communicate better. So part of that will then also lead to more care of the spiritual side of a person, because we're learning to communicate. And so there we're also learning to explore that part of a person, and we're providing that more holistic care.
Yes.
Which includes their emotional care and their spiritual care.
Yes.
What do you see as being important in spiritual care? So religion is a part of spiritual care. What else do you see that it might be?
It might be what everybody wants to be, where they want to go, what they want to achieve at last, at the end of the day, end of the everything. What do you want to be? who you wants to be.
Yes.
To be say more precisely, who you wants to be and what you want to achieve. And I asked myself after this echo session, I asked myself, what gives me peace, what gives me happiness, and what I want to be, where I want to be. So, and I asked my two of my friends. One of my friends, she's a gynecologist. I asked her, what is the meaning of life to you? And she said, to do something for the women who are suffering from VVF, that is vesicovaginal fistula, so that they can live a better life. I said, you can go to party, you can go to beaches, you can go to restaurants, buy shopping clothes. So no, not anymore. So maybe that's a very good thing in spirituality. And I learned that from her, that people can think like this.
Yeah. And what brings you purpose and joy?
Yes.
So I hear in that question of who do you want to be is what brings you purpose, what brings you hope and joy, and where do you find resilience to get through difficult times? That I see as part of that spiritual care of a person is who are you includes where do you find joy? Where do you find peace? What brings your life purpose and hope and those kinds of things?
Yes.
I think that this is exciting to see that you are gathering such powerful pieces of learning in how you can care for children and their families in a different way. And I suspect that you are going to change things in a big way in your center.
Okay, I hope so. Let's see.
I look forward to seeing what you are able to accomplish in the future.
I don't know why Rangpur has been chosen. It's like Harry Potter. I am the chosen one. I'm sorry, but sometimes
we will draw the lightning on your forehead.
Yes. Why me? So many pediatricians, so many people are in this whole country.
Yeah.
It feels like that. That's why I told you. Fate brings me here.
Yeah. And you're finding purpose.
Yes, definitely.
Fantastic.
Strongly. I'm feeling it very much strongly.
I feel like that's such a good way to wrap this up, is the way that you're finding purpose in this work. And I'm so glad that I could be here with you in person. And also, I'm very excited to see what the rest of the year brings for you in the fellowship and what you might be able to accomplish in your program when you go home and the future. So best of luck to you. And thank you for just taking a few minutes out of your day to talk to me.
Thank you. Thank you, Rachel. I feel honored for getting this opportunity to talk to you and talk my heart open.
Thank you for listening to this episode of the Sunflower Palliative Care Podcast. These podcasts grew from a seed of an idea as we talked with our colleagues in the Sunflower Children's Network. The Sunflower Children's Network is an initiative of Two Worlds Cancer Collaboration, which focuses on children's palliative care. We hope to build a world where no child suffers from serious health-related issues. To learn more or to donate, please visit twoworldscancer.ca.